All right, for those of you that don't know me, I'm Dr. Jeff Rocker, Medical Director of Skinology. I'm also in family practice next door. This is Paula. She's a patient of mine from next door, also a client here at Skinology. And I selected her for a demo for a new product called Evolence, which is a new collagen product that has just come on the market. And collagens were some of the first fillers that were used. And the problem with collagen, the original collagens, and they were animal-derived proteins, was that you could have allergic reactions to them. You'd have to spot test people before you could actually give them the product. And the other problem was they didn't last. They would only give 2 to 3 months worth of stability. So Evolence is a new collagen product that is derived in such a way to increase its durability. And it's been tested against one of the leading hyaluronic acid products, Restylane, found to be just as effective, last just as long. He'll be able to add a little bit information to that. I've used this product a couple of times already, and I have to tell you, I just love it. There's things that we can do with this product is we can fill the nasolabial lines, smile lines, oral commissures in here, and the product stays pretty much where you put it. You're able to mold it in place, but one of the best things about this product is that there's the swelling and the bruising is much less than what you see with the other fillers in the market. And so what was interesting about Paula and why I chose her for this demonstration is we had recently done hyaluronic acid in Paula's lips. She was very, very happy with that. And we also did hyaluronic acid here. When she came, she complained that she always looked so very, very sad.
I look mad.
And she had very, very deep lines here. And you can see she still has some lines here. And the reason for that is
because I never saw talking.
Well, I'm going to get into that. This particular area is very hyperdynamic. There's a lot of movement, and if you're a big talker like Paula, then the product will leave much quicker, and that's a problem with hyaluronic acid. If you put it in a very hypermobile area, the body can displace it and move it because it's mobile for 2 or 3 weeks. So I thought that she'd be a great demonstration for this product.
Girl, you should have seen when he did it the first time.
We've got some pictures.
Oh my gosh, I just started bawling. I could not believe the difference in how I looked. I mean, you can ask Lynn.
Yeah, that's true.
It really was
she
moving.
She was just full of tears.
It was beautiful. I mean, I just couldn't stop looking at me. I did not look unhappy. You know, I looked like I felt inside. And that's what I was explaining. You know, somebody said, how does it make you feel? What does it do for you? It makes you feel like your heart feels. You feel happy. You look happy. And I don't want to look in the mirror and go, God, why do I look so miserable? I'm not. Well, I don't anymore. And I'm not going to after the next 30 minutes. So.
Now, one thing about this product, hyaluronic acids, Restylane and Juvederm, can be used pretty much anywhere on the face and the lips. And that's really the only products that I will use in the lips. Evolence is not indicated to be used in the lips, and I will never use it in the lips. And you know, I've talked to you guys before about Radiesse, which is another product that I really like, that I use for kind of deep structural, when I want to build some cheekbones and things like that, which is another great thing we'll do another time.
So what I'll do is I'm going to back up a little bit because Dr. Rocker hit a lot of the most important points of Evolence. Evolence is a Johnson & Johnson owned product, and Johnson & Johnson took about a year to go over to Europe and research all the fillers because there's probably 200 fillers on the market in Europe. They don't have to work in Europe. They don't have an FDA system like we do. It just has to be safe. It doesn't have to be efficacious. So they wanted to bring something to the U.S. market that was going to work, that would eliminate a lot of patients' concerns as far as like the product wearing off after about 6 months. So they brought this all-natural collagen derma filler, which Evolence is the first all-natural collagen derma filler because unlike the other products that are mixed with glutaraldehydes and BDDE and other types of substances that gives them the duration, we mix ours with sugar. So once it breaks down, it's very natural. The reason why we used collagen is because collagen is it's the building blocks for the skin. Collagen provides the structure, strength, and support that your skin needs to look vibrant and healthy. And what happens over time is, our collagen begins to break down, and you're looked with this tired, or just the appearance just always look tired. You look sad, and you usually notice it right away in the face, especially around the nasolabial folds, the oral commissure. You start to get the downturn around the corners of the mouth. And Evolence, because it's not a hyaluronic acid, because it's a collagen product, it's a structural implant. What it is.
How long does, after he does this, what should I do tonight? Anything special? Should I not worry about nothing? Just go watch Big Brother and be done, right?
Yeah. And at first, we had a lot of physicians, a lot of plastics and derms that were kind of, poo-pooing the product because it was another filler. Well, there's only a handful of fillers on the market, and this product does compete with Restylane and Juvederm, but we found out that a lot of the doctors love the fact that patients are walking out of their offices not looking like they've had a bunch of work done.
I'm gonna cry again.
Is that more what you were looking for?
Yeah.
Okay.
Fellas, can we suck all this out?
Look, see, and it looks very, very natural.
Look, it even has my little dimple thing I used to have. Oh my gosh.
There you go.
Now,
Perfect.
Did it hurt?
Absolutely not.
Really?
The first injection, you feel like a little bit of a sting, but it has the Novocaine in it, so no pain.
Oh, really?
No, excellent. What do you think? I think it's a visual. I think it's a drastic improvement.
It's maybe drastic to you, but not
subtle.
to me.
Is it subtle?
Yeah.
Like it looks so
you don't
natural.
look like you've had work, if that's what they call injecting.
I think they do call it work.
I'm not sure that's the same thing though. It's not like you didn't get cut. So,
but
he worked hard.
He did work hard. We were sweating over there in that light.
Yeah, it was
but
hot.
I think what it does is it just makes you feel like you want to feel. Like I was saying, like your heart, you feel something. You know how you feel all happy and you're walking by a mirror and you look at yourself and you go, "Well, is that really how I look?" And then you go put makeup on and you go, "No, that's how I really look.
Yeah.
That's how I feel."